Mrs. Amina, the doctor's ready to see you.
Assalamualaikum, Doctor.
Salam. How are you today? Have you had your breakfast?
Yes.
Okay, so did you bring your book?
Yes, I do. Sure.
Thank you. Okay, now you're entering your second month of your second trimester. Today we're gonna do your monthly checkup as usual. We're going to take your blood test, your urine test, and your blood pressure. Okay?
Okay.
Okay, based on the result, your urine test is okay. Your red blood cell count is okay. However, your blood pressure is high. I think you have gestational hypertension. Actually, this disorder is common in pregnant women who are in their second trimester. So, I will prescribe you Methyldopa, which is an antihypertensive. This drug is safe for pregnant women, so don't worry. Here's the prescription form. You can go to the pharmacy to get this medication. Do you have any question?
I don't think so.
Here's your book. Thank you.
Okay. See you at the next month checkup. Thank you, Doctor.
Welcome.
Okay, Mrs. Amina. So your doctor has diagnosed you with gestational hypertension, right?
Yes.
Okay, so this is your medication prescribed for you, which is Methyldopa. Okay, did the doctor tells you what this medicine for?
It's to lower my blood pressure, right?
Oh, okay. Correct. Okay, so when you are taking this Methyldopa, you might experience some common side effects, which is drowsiness, dry mouth, sleep disturbance, and also mild rashes. Okay, so you should not worry much about these side effects. However, if the side effects persist and become severe in time, you should come back to us and we will evaluate your condition. Okay. However, there are also some adverse effects recorded for this Methyldopa. The adverse effects of Methyldopa includes hemolytic anemia, Parkinson-like syndrome, bradycardia, and also rebound hypertension. Hemolytic anemia. It develops when the antibody, drug, and red blood cell interaction occurs. It can also happen when the drug, in this case Methyldopa, alters the red blood cell membrane that will induce autoantibody production. These abnormal cells or cells coated with antibody are cleared from the circulation by spleen and liver. The premature destruction of red blood cell leads to anemia. This hemolytic anemia condition can be tested by Coombs test. Parkinson-like syndrome. Methyldopa will reduce the dopamine synthesis, which is the precursor of norepinephrine and subsequently epinephrine. The reduction of dopamine will impair the normal function of brain, thus resulting in tremors expression in patients. Bradycardia. Methyldopa that reduces the production of norepinephrine causes reduction in the sympathetic action as well. It will lead to the lowering of peripheral resistance and also the cardiac output. It is followed by the reduction of baroreflex to compensate the lowering of blood pressure. This condition will make the heart rate slower, resulting in relative bradycardia. The last adverse effect that we will discuss is rebound hypertension. This phenomenon can occur if there is a sudden withdrawal of Methyldopa. So we know that Methyldopa acts on the alpha-2 receptor that exerts negative feedback action to reduce norepinephrine release. Thus, abrupt removal of Methyldopa can induce rebound hypertension. To simply explain this phenomenon, Upon removal of methyldopa, the reduction of negative feedback actions is detected, which signals that there is a low release of norepinephrine than what it should be. Then, the vasomotor center will induce release of norepinephrine that will subsequently increase the sympathetic action. This will later shoot up the blood pressure, causing the patient to experience what we call as rebound hypertension.
Okay.
Methyldopa was first discovered in 1960. It is on the World Health Organization list of essential medicines for the most effective and safest needed in the health system. When Methyldopa was first recognized, it was the mainstay in anti-hypertensive treatment, but then it declined due to the adverse effect and also the emergence of more tolerable agents such as alpha blocker, beta blocker, and also calcium channel blocker. Nonetheless, one of Methyldopa's still current indication is in the management of pregnancy-induced hypertension (PIH), as it is relatively safe in pregnancy compared to many other antihypertensive drugs that can affect the fetus.
Next, we are going to talk about medicinal chemistry of methyldopa. This is the molecular structure of methyldopa. Each of the group in this drug has its own function. There are 4 groups in total. The first group is hydroxyl group, carboxylic acid, secondary amine, and lastly benzene ring. Next is structure-activity relationship of methyldopa. There is a structure-activity relationship that is responsible for the binding interaction of this drug with its binding region, which enable it to show its antihypertensive effect to the human body. The first one is hydrogen bond donator. There are a total of 4 hydrogen bond donator in this drug, which enable it to form a strong hydrogen bond interaction with its binding region. Then, there are also hydrogen bond acceptor. There are a total of 5 hydrogen bond acceptor present, which also enable it to form hydrogen bond interaction to the binding region of the body. Next, the conversion of prodrugs methyldopa to active. Methyldopa is transported actively into CNS, where it is decarboxylated by AADC enzyme in the brain to alpha-methyldopamine. Then, it will be beta-hydroxylated by DBH enzyme to give the alpha-methyl norepinephrine. This active metabolite is a selective alpha-2 agonist.